Hello everyone, myself Dr. Sandesh Patil. We will discuss a very important topic today, which is ectopic pregnancy. What is ectopic pregnancy? Ectopic pregnancy is a pregnancy occurring outside the uterus. That is, it is outside the intrauterine cavity. To understand the ectopic pregnancy, we must first know the normal anatomy of female reproductive system. If suppose this is the uterus, this is the lower part of uterus, this is the upper segment, and this is the vaginal part below the uterus. On both sides there are fallopian tubes and bilateral ovaries on both sides. In the ovary there are multiple follicles growing. Follicles size increases from small, that is the primary follicle, and it gradually increases as a secondary follicle, and later on in the end as a Graafian follicle, which is a mature follicle. In the end, at around 14 to 16 days, this follicle ruptures and it is been picked up by the tube with the help of these fimbriae. When the follicle is picked up by the tube, it remains in the tubal region where we call it as ampullary region. After that, after the intercourse, when the semen travels through the vagina, through the lower segment of uterus into the uterine cavity, these sperms travels through the tube, it unites with the follicle which is ruptured and forms the embryo. This embryo gets transported from the tube into the uterine cavity, and inside the uterus it gets implanted. This is what happens in normal pregnancy. What is ectopic pregnancy is, in ectopic pregnancy, this embryo does not travel inside the uterus. It may remain inside the tube, it may remain at the ovarian, it may remain outside the uterus, that is in the abdominal cavity, or there is one condition which is called as scar ectopic pregnancy. In that, the embryo gets implanted into the scar. In this photograph, you can see there are multiple sites of ectopic pregnancy. Like the most common one in fallopian tube, the second most common is in the ovary. There are other sites also like interstitial ectopic pregnancy, and as I said, in scar ectopic pregnancy, there is one more thing, that is we call it as cornual ectopic pregnancy in between the tube and the uterus. What are the symptoms of ectopic pregnancy? What are the complaints usually patients have during the ectopic pregnancy? So the most common complaint is bleeding per vaginally during the pregnancy, along with lower abdomen pain or pain in left or right iliac fossa depending upon the site of ectopic pregnancy. Along with it, patient may complain of giddiness. So how to diagnose an ectopic pregnancy? So there are many investigations which will help us to rule out whether it is an ectopic pregnancy or normal pregnancy. The gold standard investigation is the sonography, that is the scan. With the help of sonography, we will come to know whether the pregnancy is ectopic or not, or whether it is a ruptured or unruptured ectopic pregnancy. So there are blood tests also, screening blood test, which will help us to conclude ectopic pregnancy. The blood test is beta HCG blood test. How the beta HCG blood test is done? The beta HCG blood test is done on day 1 and day 3. That is, we repeat beta HCG after 48 hours and we compare the levels, and we will conclude whether it is a ectopic pregnancy or not. Once you have been diagnosed as an ectopic pregnancy patient, first thing you need to do is to report a gynecologist. Your gynecologist will help you regarding the management of ectopic pregnancy. What is the management of ectopic pregnancy? There are two treatment lines for this ectopic pregnancy. The first one is medical therapy and the second one is surgery. So depending upon the site of pregnancy, size of pregnancy and the complaints, doctor will decide whether you should go for a medical therapy or surgical treatment. In the surgery, laparoscopy is gold standard management for the ectopic pregnancy. We remove the ectopic part of the pregnancy With the help of a laparoscope which is inserted inside the abdomen and the ectopic pregnancy is removed, patient is discharged within 2 to 3 days after the procedure. The recovery is very fast after the surgery and the prognosis is also very good. I hope my video was informative for you. So if you are diagnosed with ectopic pregnancy, do not get scared. Consult your gynecologist and listen to him. He will guide you. Thank you for watching this video.